Hello and welcome. This is Dr. GERARD CUOMO recording from my dental office here in Boca Raton, Florida. First of all, I want to wish everybody a very happy and safe 4th of July weekend. I'm here today to educate not only the patients of the world but also dentists around the globe. Simply put, microscope enhanced dentistry is by far the best way to treat your patients. In my office, I have a number of high-tech pieces of equipment, but by far this piece of equipment, the dental microscope, is absolutely the best. Let's talk about the dental microscope. Here I'm treating the patient very simply and doing a procedure where they're very comfortable under the microscope. The treatment time here working on this patient is enhanced tremendously. I'm utilizing two assistants, and you notice one is focused on passing instruments directly to me. The other one is mixing or doing some other fine work just alongside. So our treatment time is definitely enhanced. It opens up a whole new world of treating patients beyond the normal use of dental loops. The majority of our dentists, I want to say about 85 to 90% now, are using some form of magnification, but yet only 1% of dentists in the world are using dental microscopes. Why is that? Well, we know that dental schools are partly to blame because their focus is on treating patients at the level of the dental loops. They haven't ventured to even offer classes using microscopes, and not only that, but dentistry overall has only made it mandatory to use dental microscopes on the side of root canal therapy. So your endodontist or your root canal specialist are the only ones that have to use them as a standard of care. Dental microscopes allow me to see my patient's mouth in 3-dimension at various levels of magnification. These are some examples now of what I'm able to do with the microscope. Here's an implant case that I've been working on, and the dental surgeon placed them in not so, I want to say, routine areas, and so the case is somewhat complex. Now I have to make this case better for the patient. So here is a specific example of the level of care. We're able to treat things at a much better level. Let me tell you why. With dental loops, which are used mostly in the industry, or they're also called jeweler's loops, they can only be able to be used at a very low power of magnification. Most dentists have visual limitations. They will use 2 to 3.5 power loops. Each pair of loops has one designated level of power, so most operators are just going to carry just one pair of magnified loops. Although there are some that will use up to 4.5 power loops, but they would seldom take them out to use for any routine part of dentistry. And I think that's where the pitfall lies, because instead of using the 4.5 power dental loops all the time, they're just going to use it part of the time. And I've heard that from many clinicians out there. So with dental microscopes, I'm able to see teeth again three-dimensionally. I can see them at various levels of magnification. As you can see right here, the molars are blown up to the level of 8 magnification, if not 12.5. So I rarely ever treat patients around 4.5 power. I would be at least at between 5 and 8 power of magnification. And the significance there is I'm able to see things much more clearly, and I'm able to treat the patient in a much better way. So again, when you see these videos, you're able to determine even for yourself, you know, that here's one level of magnification. As we switch to even higher, and as you start to see things more and more blown up, you see more of the detail itself. And you know, one thing patients usually ask me is, you know, Doc, did you see anything underneath the old filling? And I not only tell them what I see, I'm able to record what I'm seeing via the microscope camera. So it has many advantages. Here I am working with a dental implant, and this patient is in her young 20s, and you know, we just want to make sure that we don't have any glaze that may have ran over onto the metal, which would eventually cause the demise of not only the abutment but the implant that's in bone itself. So microscopes are important. I at one time was in the development of microscopes for dentists, and at the time I was also installing microscopes in dental offices as well as dental laboratories. So I know a lot about microscopes. I know about their use, and I can tell you that with the use of a microscope, patients are definitely being benefited from this technology. Looking at, you know, the soft tissue, you can see that the detail allows me to measure properly and scrub, constantly scrubbing areas to make sure that there's no growth of bacteria within the implant site, and also meticulously checking the inside of implants. So I wanted to make sure that you were able to see that and see what we're seeing using the microscope. Our laboratories that are set up, they're able to do their final fit checking before it comes to me, and then also checking the implants before they go in to the mouth. So try to get all of the bases covered is sometimes not easy, and so what I do is, you know, I just try to surround myself by microscope people. And my laboratories, both labs that I have, one is in Deerfield Beach, that's Toby Nielsen Dental Studio, and I installed a microscope in his laboratory, and he loves it. He says it's just amazing. It takes his dentistry up to another level. And in my in-house laboratory, it's Linda Petro Dental Lab. Her lab has, I believe, a total of 4 microscopes, of which I installed all of them as well. So here I'm working on a lower molar, and of course this is 3.5 power. So you can see now the picture is showing the molar. We're at somewhat of a distance. I'm just starting to prep the tooth, but you know, eventually I'll be at 5 and 8 power, and then all the way up to that of 12.5 power. We're much more conservative at this level. We use smaller dental burrs and dental instruments. We have the ability to have several assistants assisting. So much better for the patient, and so much less post-operative sensitivity or because we're able to work at a much more advanced level, the time of preparation is so much less because I'm able to see things and treat things much more rapidly. So again, here we're removing decay. We're also going to be removing a metallic filling. We call it amalgam, which amalgam alloys, as we all know, contain copper, tin, zinc, silver, and yes, mercury at various levels and percentages. Amalgam is a substance that is formed by the reaction of mercury with the other metals, and we know that that mercury is also used to extract gold from other metals to purify the gold in such a way to remove it. If you were to look up the use of mercury in dentistry, you should be able to read a lot of information on the ongoing controversy of amalgam used in dentistry. Again, it's a alloy that I no longer use, but I will remove it. And at times, if I can use a rubber dam, I will. If I cannot, because of an obstruction in the patient's mouth or someone has an airway problem, I don't have any other alternative other than to just use high-speed evacuation along with lots of water. So this tooth preparation now is being done using the dental microscope, and what we normally do is just trace out the filling. That's what we're doing, just outlining it, and then we'll use another instrument to elevate it so it comes out in either one or two pieces. And this way we're not subjecting the patient to a lot of the trauma. Again, here I'm just utilizing an instrument to remove the amalgam, and out it comes. We have a little screen attached to our suction tip. So if you need a second opinion and you're willing to contact our dental office, we'll be happy to give you as much information as we can about your case. If there's just something about it that you don't or you don't feel comfortable about and you want another opinion, feel free to contact us here at my dental office. My number is 561-391-6290. Our office hours are Monday through Thursday, 8 to 5, with a 1-hour lunch break between 12 and 1 o'clock. And we will open our doors every other Friday from 8 to 5, again breaking for lunch from 12 to 1. And right now we're looking at a root canal specialist, and again, the purpose of the microscope is not just for the use of a microscope for root canal therapy, but it should be used by the general dentist. And so I just want to thank you all for watching, and would be happy to hear from you. Feel free to contact us again at our office, and our number again is 561-391-6290, or you can catch us on our website at www.GERARDCUOMO.com. And again, take care and enjoy the rest of your 4th of July weekend, and we'll look forward to hearing from y'all. Take care.